it is going on, how there is going to be in future to make the changes in this. They doing more than 750 surgeons from India, all over parts of Tamil Nadu today. And with this, and we come all only to this. And the press was taking work and these communications. You all know that Arunraj and respected Health Minister of Tamil Nadu government recently taken to work. First, I have to thank, appreciate our respected Chief Minister of Tamil Nadu, Sri Vijay, for making one of our doctors to be Health Minister. Somebody you see that we have educated before getting into now, man has come to city at that very dynamic and studied in Madras Medical College. Then subsequently worked in a PhD. Of course, he was not the aim of practice, but he learned PhD practice of the world. During the time, he studied for a year ILS and self-service, he got an IRS in German. Income tax, the commissioner was working. So some of them, I listened to his talk. One of the young engineers says, I want to serve the community. That service, it can be an officer, it can be a doctor, it can be, but being a civil service and administrator, it could do much more. There was a day, and God is with him. And very gradually, as man suddenly leaving a year, become a politician and become a health minister, something else. He never talks about politics. Few days back, he was in Salem Medical College, I think, and he was talking, saying, he understood it, dear colleagues, health minister addressing a doctors, they all graduated, I think so. Colleagues. Then he also mentioned how love to be a doctor, and I'm very happy. And I also feel young because of being like a student since that was mentioning. When he said police and love to be called a doctor, that is the greatness of civil society. Coming from Saint Simon will say, I'm very happy to share. And I had a recently had been here for people. It's so busy. You all know the visitor's chamber how it is. And even people next. His intention is one way that we all encourage something that we want to do community now. That way, ministers got a lot of dynamism. I think we are very happy. We had a lot of problems in and the government of practice, the legal, medical, all. Who know all the problems will help us and we very happy we coming in as a student today. And he is also very keen to develop technology for this concept. And Sendinathan and then also there is my own young colleague and he's a CEO. And he only just made have been invited to minister. And Sendinathan was very curious since last 1 year. Uncle, we have to do it this program. This is where technology going, going. So yeah, actually minus, we are always dynamic. They make it complete initiatives of making it. And Arunraj and that young team of their hospitals, both sides, together work along with them making this program. You have seen today since morning that how it's going, and life surgery got done, and a lot of surgeries are shown. And today, 4 screens going, every one of you could see, learn what you want. Because everybody will not know everything. They interested in some specialty according to them, and no discipline study. First time everybody could see that listen what they wanted to connect to screen 1 or screen 2, something like it. That way, very nicely done. Life surgery showing all the faculty is excellent. And the first time they created a history, patient at Coimbatore and the colorectal cells, resection by that knee at sitting at Coimbatore, and the reconstruction I came to function. Central and Chennai, reconstruction between the same patient at Coimbatore. This is the first time we see India. It opens the limitation. There's no limits. For example, the way he talked to this meeting, usually cinemas they narrate the story then make it cinema. It may be real story, it may happen, may not happen. But I'm seeing my example analyze so many years. and he's close friend of mine. So he is vision. Narrative science, how it has to be. And 2030, he made a narrative saying, robotic surgery, the high-tech surgery will go to rural side, go to a patient where it is, and it is not only healthy, the surgery can be done. That whole model. And he is a Chandrayaan successful man. Today we call him old man. He made it that. But he said, not 2030, I think he will reach it before. And he is also now committed Mars reaching it. So India is once considered undeveloped country, a poor country. No more India's poor country. We have enormous energy. In fact, potential young energies in India only and youngsters in all the fields. So this technology conference will have its own way, and first time the initiative is taken to combine surgical technique and technology. Very simple. Without technology, no more it can happen. And it is has to go different way. Robotic surgery, it is those days I see teachers, the instrument teaching, stupid, you have to learn like this. Now the robot also teaches like this. If I hold an instrument, today's, you all know that, so which robot I use from one to even hold slightly tight, after you are tightly holding the legs, it teaches. And it navigates. It tells you where the plane is going around because there is a separate simulation part. And if you necessarily do ultrasound to look at vessels or not. So today, and this while technology taking different the safety, for example, few points were there. One is accuracy is more, so precision very 3D vision, exact clarity, so much perfect application. Tremor filtering, we have a human being somewhere, it filters tremor and safety, and also empathy intelligence. Preoperative planning, it makes up helpers. During surgery cancers and post-op also it predicts which patient going to develop complications. So you are taking it before I have to say. So me, all of us is learn about things go. This conference tries to teach you as much as possible, but all of you put all together together. And today it's still India has gone to that level. We are all trying our best. Even Indians taught the world that laparoscopic surgery no more cost. High cost it was American standard. Even China was not taken initially because it's high cost comes to China. But look at India. Oh, Indians doing it very affordable way and much better. The Chinese president visit Coimbatore hospital that day. He was so excited back by Arunraj conference. He mentioned the same. Looking at Japan, America is too costly. But this is the Indian change my mind. Indian model suits China. That is what 2004 Shanghai conference and Singapore 1992. So Indians capability, but only we need the support from government, both the state and center. For example, individually they are trying to learn, but there is no skilled based training centers at government based. So I this time I have an opportunity to help us to take the training center. We have society with 20,000 members and young hospital is training center. And government doctors committee young hospital for bariatric surgery training. And also cancer, minimal disease cancer. So many innovation we have. And every country recognizing it. But my real success is to reach the youngsters and all the across. So it is our cost. See, cancer patient coming getting surgery in 2 days, 3 days away. Colon cancer reaching second day country. Gastric cancer second day at home. I was thought this way operated cancer demonstrated like next day, third day, I'm going to my infinite box, patient room. Thanks, doctor, operating me at home. Not even not it was cancer. At home, enjoying the things. So that day it is gone. So it has reached common people. And for which individually we cannot do much unless until we also to be said. I'm sure our minister will help us this again and again. And we will know him different way, make it up. And thank you very much. Yes. And thank you for taking my time and the wisdom. I welcome every one of you. I thank the press people. Every time they show, these are the people taking the awareness. Indian people still lack awareness of the problem. You say cancer, they will. But message reaching it is affordable, right? It's curable, transcendent patient. Every time these people and all the delegates, my friends and the speakers who spoke today so much well. I appreciate that. Thank you very much.
Kind, and this is exemplified by the fact I'm standing before you to tell what this program is all about. Never before we could able to see. We all it's well known that conferences either laparoscopic or robotic, but here I'm going to brief and then tell what's all about this TECHNOSURG and the other things in about 2-3 minutes. First is the TECHNOSURG, GEM TECHNOSURG, which is, as Hon'ble sir said, the conglomeration of surgical technique and technology, including artificial intelligence. I'm glad our Tamil Nadu government has inaugurated a separate ministry for artificial intelligence, and I think it's in the right direction. We all could take a cue from that initiative from by the government of Tamil Nadu. So next is robotics, then fluorescence guidance or any technology that is associated with the surgical field. To commemorate and also to stress, this is the first conference of its kind, and we just show a small multimedia of what the GEM technology is all about. The technology and technique is coming together. The next I'm going to tell is about Operation Infinity, wherein telesurgery is taken to next level. And today we have witnessed one such surgical extravaganza where the patient at Coimbatore, operated by a team of surgeons led by Dr. Hon'ble Minister at Coimbatore. The next half, the reconstructive work is done by me, led by me at the GEM Hospital in Chennai. And this is the future. And this is the first time dual console surgery done for such major procedure like choledosis across the globe. I'm happy to announce this one. Not to mention, this is one of events. We are going to offer this one to the public at large. So nowhere we will be far, nowhere is remote as far as medical facility is concerned. From anywhere or any part of the country, in fact, we are planning to have it in Mauritius also. Anywhere to anywhere, we will be connected through this instrument called the Robo. So that's the Operation Infinity. Again, a small multimedia presentation of Operation.
What distance now they find social excellence for the first time in India. 2 cities, 1 surgical network, introducing Operation Infinity, where robotics, artificial intelligence, and human expertise unite beyond geographic boundaries. No distance, no boundaries, no limits. A historic milestone redefining the future of surgery in the patient's care. Operation Infinity. The future begins now.
And the last agenda for me is to introduce an association. So all these techniques, especially the artificial intelligence in healthcare, we don't have a proper association. For technology, it's always on the sidelines. For the first time ever in India, we are going to start an association which will deal with all the surgical technology, which will be the via media between the innovators and as well as the end users, the community, the medical care community, as well as the innovators come together through this platform that's called ASTRA, Association for Surgical Technology, Robotics and Artificial Intelligence. I'm again glad to reveal the new platform ASTRA. And to add to that, luminaries like myself and Arunraj sir, IIT Incubation Center already are on board to develop this into a world-class platform for the innovators and the end users to come. So that's all about Astra. And with this, I end my talk. Thank you very much.
Chief Guest Dr. Arunraj, Honorable Health Minister of Tamil Nadu, Dr. Paranivelu, and Vice Lieutenant Sedhira. Really, it's a revelation of the evening today. Yes, I gave a lecture like any other conference. After that, every inauguration. Actually, is wonder nominally for science and technical conferences, we start with the inauguration and continue. But wherever I go, surgical, medical science, basically, their conferences goes this format. I used to wonder. But now you look at here, of course, still I was wondering also, for someone else, whenever I have. But notwithstanding that, I have, maybe I told that nearly this is 25th conference of medical fraternity already. But I don't see the end of the day this much hardly getting better. I think it's way it is happening because the reason being, the people are TECHNOSURG itself was giving some sort of a new blood. I think that's what after jump next new bloods, both of them are jumping with a lot of energy and enthusiasm and dynamism. This is what today's India, today's Tamil Nadu talking about young and elders joined together, how ever system is there. And techno-surg itself, though it is called technology and surgical, surg is called, it is surge. Okay, I think it looks like that that's what it's coming. The surge means that they push with the energy. Then beyond that, when they're talking about end of the day today, talking about Astra, Infinity, like that, when you keep coming up, that shows the new way of one is technology amalgamation into the medical science is one thing. Normally we talk about two corners, two poles like the engineering and the medical sciences concerned. But now two sciences are coming together across the world. I think we cannot lag behind and studying. Now, not only that, you have taken lead. I think that is the message of that surgery study. That's what I feel. That no surgery means we have to go ahead. We are not just follow somebody else. Okay, whether we can go there. I think that is what when we talk about Astra is concerned. That's how I see that now. Because the day has come, the convergence of the technologies. Because when we are within the engineering parallels, many technologies are converging together. Without computers, no technologies there. Today, without the artificial intelligence, not many are there. Like that, when it's keep coming, definitely within the medical science also, many things of that technology is getting introduced there. When that is happening, the convergence of the two sciences also got for Astra is nothing but that. That's what I feel that. Okay, and that is the one when it's happening because Tamil Nadu is known where the education and healthcare is concerned. We are much ahead of that. So you're not looking back, look ahead and keep moving forward. Okay, you keep go as fast as possible, as far as possible, taking the people along. Okay, not only you are going along, taking the people along. So that's how this TECHNOSURG is coming, Astra is coming, so that you don't lag behind the technology is concerned. You increase the technology and increase the technology such that how it can blend with the today's society and which is moving forward for tomorrow. Okay, when that's happening there, many things are happening. Today's demography of Tamil Nadu is totally getting changed ahead of India is concerned. Okay, the younger population versus the elder population is a lot of debate is happening there. When that is happening, beyond education, healthcare is the paramount thing is there. Okay, the elder population, it is life expectancy 74, 79, 80, 83 keep moving forward. But that means their productive life also going up. It is not only the age, it's a productive life also. Not today, look here, the people at 70 and 80 also equally well working with along with the youngsters. And the youngsters, that's one way. Another way is concerned, the disease is not differentiating young or old. Okay, this is another paradigm which is happening there. So towards that, definitely healthcare is a real thing. So that means healthcare needs to adapt for this changing requirement. The changing requirement that means adaptation can come until otherwise we update, won't update it, this will not happen. So today, I think that's what's happening there. I'm really, really happy to see, look at the medical practitioners talking about technology in a much detail, much depth. It's not only breadth, breadth is that beyond the breadth depth also I'm saying, okay, be it telesurgery, be it robotics, be it fluorescence, whatever we're talking about, the ways how AI is can talk about diagnostic, AI can help you during surgery, AI post-surgery. I think it's all the parents are if you wait, that's how already the Astra started coming. You have a good number of lecturers are coming like that, I see that. So that way, it's really at this point of time, the capital city of Tamil Nadu, we are all sitting here and listening and watching and ready to be part of such thing. And that's another thing. Okay. And the media also has come in a big way. And this is called for because yes, Dr. Parnigan has told, no longer the cancer is an untouchable or something like that. You feel about that. Once you know early, once you go to the doctor early, you're getting cured is much faster, much easier. And this is like any other flu or other thing like that. It's happening there. And it happens. So that way, many things are happening. You look at even the latest COVID thing is concerned. So the gone are the days for the vaccination to come nearly decades, people used to wait. And within a year that it has come, it is again the convergence of technology of simulating and doing the things there and accordingly to come out in the system and many things happen there. So that way, either to reacting to the diseases or predicting something, preventing something, many things are happening there towards that can work. Beyond all these things, the convergence of engineering and science definitely it shows the way to the young aspirants. I used to tell the people like that, you have not gotten into your name, don't worry. Okay, you have medical science waiting for you to deliver for them. Okay, for that you have lot of opportunity, plenty of opportunity. My exam and already studied only BA, but definitely he is working with the certain subjects today because engineering science enables you to look for what they are waiting for. What they're waiting for is engineering can do. So I think you have a lot more to do if your interest is only to one medical science, definitely engineering science also will enable you to move forward. That way, I think definitely we can tell the people, don't get disturbed that if you want aspire, yes, anything you can do, but if you're not getting that, I think stops that. Definitely you can get along with that. Your life and along with that you can go. So that way, Astra is going to give a new birth, new life, new aspiration, new things for us. And for that, today, Honorable Minister also part of that. Anyhow, I think I was telling him, I was working for the space area until recently, and thanks to Dr. Hon'ble's introduction, when the first their robotic system installation in the Jump Hospital in 2022, he was asked like this. Then I told, yes, your techniques are people are following elsewhere. But why you are following it in the recommended technology from outside? Why can't you do it here? I think that question I raised, the question's answer is today I'm standing with the support of SSA, which is indecently built which is going across the country. Anytime you make it FDF also. That means குடியினுடைய கூட்டத்தையே போய் அந்த மாதிரி டாவின்சி இடத்துலயே போய் நம்ம 1 செகண்ட் 1/4 of place நம்ம போக முடியும் ஒரு நம்பிக்கை இருக்குது அந்த வகையில today's emergence of Tamil Nadu in health also possibly so we are also can be leading in the global health point of view. Not only techniques, technology also will do. I think the stroke will make that happen. Thank you.
Honorable Sir, for inviting me to this sort of event where technology is shaping the future here. And regarding Honorable Sir, I must mention that when I was doing medicine in Madras Medical College, we used to wonder, that was in way back and nearly 25 years back, I did medicine during 97 to 2003. When during our surgical postings, when we see surgical gastroenterology cases, any lump surgery, kind of tumors, those sort of things. I vividly remember my senior used to tell, there is a doctor in Coimbatore to do laparoscopic surgery for these sort of cases also. And really, it's another pride moment for the state of Tamil Nadu Sir, I did the first laparoscopic surgery way back in 1991. So really great, sir. It shows your enormous vigor to pursue excellence in medical field. And one thing I noticed about this function is that I'm really impressed about this terminologies or naming of this event. It's called TECHNOSURG. Technology blending with surgery, and also it's meaning that we are pushing forward. Surge and Operation Infinity. So infinity is what we all know. It can't be measured, or it is something universal. So man, really, very my much appreciation for the team for choosing these sort of names. Really inspires. It what it pushes us to cross our boundaries, and really I'm happy to be here to for this inauguration event of this TECHNOSURG and this Astro and these other things. There is no escape from technology. If one thing which is constant, that has changed. We all agree that how technology has been shaping us in every field, be it medicine or on education or governance. Every field, technology is shaping our day-to-day life. During independence, our life expectancy was only around 30 or 31. Now this our life expectancy of our country is 71. Technology has played a very vital role in this journey. Lot of innovations, lot of inventions, lot of discoveries have their role in this, be it discovery of penicillin or discovery or invention of MRIs, CT scans, ultrasound, or even SET. Everything have played their role. I remember when I mentioned SET, I remember my professor used to ask me, what is the most important part of a stethoscope? Yes. The part between the two earpieces, he used to say. So that is our brain. So anything, any technology which is in the hands of the right person, with the right mind, with the right brain, and the sense of humanism, will do wonders. So technology is definitely inevitable. At the same time, we as a part of the ministry, we expect or we desire that it's blended with humanism so that it reaches every nook and corner of the state and also reaches the poor and needy. So our government, under the leadership of our CM, Chief Minister, C. Joseph Vijay, our mission is to make government sector complementary to private healthcare delivery systems. Our mission is to ensure that each and every citizen of Tamil Nadu have this world class or standard quality healthcare and even in any government hospitals. So all along, emphasis has been previously to ensure all the vacancies in doctors, nurses, and other technicians are filled and necessary instruments are procured for this government setup. Now it's time to push for the next generation of reforms where we now are talking about a patient experience, just like how a patient goes into corporate hospital and finds it as a pleasant experience. We want to bring that experience, or to say we want to minimize the hardships, hard feelings currently we face in government sectors, be it waiting time or this ambience of this cleanliness of the hospitals, the way the patients are being treated by the government staff. As if it is healthcare delivery is not a thing of mercy, but it's a thing of rights. So we want to ensure that the poor and needy of this Tamil Nadu also get this all the facilities which are available in this currently being developed by this private sector. Coming to private healthcare these corporates in Tamil Nadu, they play a vital role in bringing in new technologies. And indeed, it's a win-win for everyone to have a healthy private sector because they also cater to the needs of various segments of the society where they take the much of the load of government hospitals. Now with this same health insurance scheme also, private sector is also taking the much of the load of the total load presently in the state. And one thing which we are planning is that we want to promote more health tourism, medical tourism. In this regard, we are planning, we are in the initial stages of developing a medicine so that we can bring in more revenue to the country and bring in more employment, local employment to all those associated with the sector, where even there also government sector will also will be a participant, will be accommodated to this private sector. We can very well take this the amount of needs which is prevalent in other countries where we can give affordable healthcare at a fraction of cost compared to other developed countries, for example, in Europe or America. So we look forward working with the private sector also. And also we have, I'm thinking of maybe after discussing with our Hon'ble CM to have a conference of Tamil doctors worldwide. So we have one Bangladesh here. We are having so many doctors who originally have graduated from Tamil Nadu from our government medical colleges who are very successful all over the world, be it America and Europe or Australia, everywhere. Maybe like World Tamil Conference, we can organize a conference of Tamil doctors so that they come here. They can also share their experience, and we are also thinking of creating an enabling platform how they can also contribute to public healthcare delivery for this welfare of the state of Tamil Nadu. So all these are possible because of one man, our CM, who had brought in a revolution. Nothing less than a revolution because nobody would have imagined even in the wildest dreams that this kind of things which are taking place now in the last 30 days might happen. So his vision is only one thing, to give a clean, transparent, accountable governance to the people of Tamil Nadu because Tamil Nadu deserves better. How governments have been compared Tamil Nadu's health standards with other states of India, but time has come for us to compete ourselves with the best of the world's standards. So this is not in this government, there never ever can happen. So we are all getting this. And it is only this regard I like to say. We'd like to partner with private sector also in this regard, wherein you bring in innovation and we'll slowly catch up with you and we'll bring quality healthcare to all the people because it is our fundamental right for every citizen to get this healthcare, like education also. And I don't want to take much of your time. I know this is a technology conference. You may not like a politician speaking word. So once again, I thank you for this wonderful opportunity to be along with my doctors, and I wish all the doctors here every best. Thank you all.